February is National Heart Month. Heart disease is the #1 killer of women. I sat down with Dr. Rachel Hailey of Lee Summit Medical Center to find out what steps we can take now to take care of our heart. Dr. Hailey, one of the things I was astounded by are the numbers. It's estimated that 1 in 3 women will die from a heart attack or stroke versus 1 in 33 who are estimated to die from breast cancer, except we hear a whole lot more about breast cancer and how to prevent it. So what are some ways that we could actually prevent heart disease?
You know, you're right. It is scary, and I think we underestimate the heart issues that women can face. In fact, 80% of heart attacks can be preventable with lifestyle changes and modifications, and women need to take charge of their own heart health. They need to know what their risk factors are and what they can do to modify them. They may need to take medication. They also may need to undergo some heart testing, so it's important to get with your provider to figure these things out.
Why is it so important to go ahead and get a coronary calcium scoring test?
A coronary calcium score is a great and easy test that can be done that can help risk stratify you and help your physician know what level you're at. It's great for people who have no symptoms but have risk factors like diabetes and high blood pressure and high cholesterol. You know, we do recommend a physician checkup before getting that test, so it's going to be explained to you, and then afterwards, you know, to know your number, to know whether you need additional testing, a medication, or even a visit with a cardiologist.
And if we'd like to lower our risk level, what are some healthy lifestyle changes we could make?
One of the biggest ones is don't smoke. Tobacco causes plaque formation in your vessels. This can lead to clots, which can lead to heart attacks, and lose weight. People who are 30 pounds or more overweight are more likely to develop heart disease even if they don't have any other risk factors. And eating a healthy diet, so important. You know, get your fruits and your veggies, limit the bad stuff, limit the trans fat, the saturated fat, increase, you know, the good stuff, the protein, the lean meats. Exercise, even 30 minutes a day can help.
Okay, 30 minutes a day, and that's going to help. You also mentioned getting in some good tests. So one of those is the coronary calcium scoring test. Why is this important?
Well, the coronary calcium test can be a very good aid. It can detect if you have any plaque in your vessels, and it will give you a score which tells you which level of risk you are at, and then based on that score can tell you what you may need to do, if you need additional testing, if you need to start a medication, if you need to see the cardiologist and maybe even do stress testing. So it's an excellent screen and a very low cost for a lot of information that can help identify you and stratify your risk level.
Of course, if you're experiencing heart attack symptoms, call 911 or go to an HCA Midwest Health emergency room or accredited chest pain center. For more information, visit kcfaster.com.